Hello, I'm Dr. Lipi and welcome to my show, Health, Humor, and Harmony. Today is the second episode of my new series, Dr. Roy on the Road, where I talk to regular folks on the street about a health issue. Today's topic is mental health. Did you know that among the 60 million people in the United States living with a mental illness, only half receive any treatment? As if that wasn't bad enough, COVID-19 made things much worse. During the pandemic, many people reported feeling depressed, nervous, anxious, and even suicidal. So, what's been the experience of everyday New Yorkers? I went to Washington Square Park in Manhattan and asked total strangers two questions. Are you more comfortable discussing your mental health or your physical health? And how has the COVID-19 pandemic affected your mental health? So how did it go? The answers may surprise you. Let's get started.
Are you more comfortable talking about your mental health or your physical health?
So for me, I actually, because of the line of work I'm in, find myself talking about mental health more. But before like the last 5 years, definitely more so physical.
Got it. Do you mind if I ask what's your line of work?
So I do adult summer camps focused on personal development.
Nice.
Yeah.
So prior to this line of work, you actually felt more comfortable talking about physical health.
Yeah, probably.
And why is that?
I don't know, probably just because that's what was more discussed in my the communities that I was a part of.
Yeah, got it.
That was like a more widely talked about thing, like
Got it.
you know, fitness, weight loss goals.
Physical health was just more part of everyday conversation.
Yeah.
People were just more comfortable talking
Yeah.
about it. Got it. Second question, how did the COVID-19 pandemic affect your mental health? If at all.
I mean, I don't know if it did. I am more introverted, so for me, having some time to like not need to socialize as much, like having no ability to gather in groups was actually nice for a little bit, and then it got to a point where I was like, all right, I'm really ready to get back out there and
When is this gonna end, for
be
God's
with
sake?
people.
Yeah.
And I was also fortunate to have a girlfriend at the time, now my fiance, who I lived with. So I think it would have been different had I been living alone.
Completely isolated,
Yeah,
right?
yeah.
Okay, awesome. So, I'm Dr. Lipi Roy. Are you more comfortable talking about mental health or physical health?
I'm comfortable with either.
You're comfortable equally talking about
Yeah.
either. Fantastic. And why is that?
Because I've struggled a lot actually with my mental health, and I feel like this past summer I've truly overcame it. So it's something that I'm pretty comfortable talking about. And also physical health. I also model, so it's something, especially in the modeling industry, like body image. So I'm comfortable talking about both. It's something that I've learned to overcome in both areas.
Fantastic. That's amazing. Thank you for sharing that. My other follow-up question is, how has the COVID-19 pandemic affected your mental health, if at all?
In the COVID-19 pandemic, I think it's definitely taken a toll on a lot of people's mental health. I'd say for me, it definitely affected me because I feel like I feel a lot more isolated. But it's definitely good to check up on your friends and family. But at the same time, I feel like COVID-19 has also had a positive outlook, because I feel like you learn to overcome it and just become a better person overall.
Yeah. How did you become a better person? How did the pandemic help you become a better person?
I feel like I've gained more confidence as a person. Through the pandemic, I don't think I would be the same person if the pandemic would have happened.
That's fascinating. I think you were the first person to say that they became more confident from the pandemic. Can you tell me a bit more about that?
It's just like I was able to like express myself more because I guess like you were in school and like so like people I don't know just kind of so, yeah.
I mean, I wonder, do you think, at least for me, having more time to reflect?
Yes.
Really? And think about what's important in life. Because as medical professionals, we already know that without your health, you have nothing. But for a lot of people, the pandemic showed that, wow, a simple little microscopic virus shut the world down as far as we knew it. And it forced us to really think about what's important in life. And would you say that applied to you?
Yes.
Fantastic. Well, thank you so much for your time.
Thank you.
Do you feel more comfortable talking about physical health or mental health?
Either one doesn't bother me.
Either one doesn't bother you. Why is that?
I don't know, because just now that pandemic is so far into it,
Yeah.
deep into it, so everybody seems like they relax and comfortable with it.
Yeah.
You know, so but it really affects me on my depression. I'm homeless. You know, I try to do the best I can. I'm trying to, while I'm out here, I know I be doing other things. I'm trying not to hurt nobody. I don't have my shots. I don't have my booster. So I'm all right.
So you feel comfortable talking about your mental health?
Yeah.
Okay, very good. And then how has the COVID-19 pandemic affected your mental health, if at all?
It has some strain on it, yeah. It has some strain on it. Me, myself, it has some strain on me, yeah.
Strain in what way?
Because I'm already suffering from anxiety, depression, you know what I'm saying? And so, you know, and then I have spent a lot of time locked up, so I'm really trying to cope with all this whole thing right now.
And has the pandemic made all of those things worse?
Yeah, for me, yes.
Yeah. How so?
Because it's hard for me to get a job now, you know, and people just acting crazy now. I mean, I don't even want to say crazy, but people not taking their medication like they're supposed to.
Yeah.
I mean, including myself. So, you know, the pandemic just slowing everything down. And then it's turning people to deal with the people that they really aren't. You know, it's making a lot of people meaner. It's making some meaner people nicer. You know, so it's just have a twist on a whole lot of things.
The pandemic just changed everything.
Yes, it is. It changed the whole norm.
Yeah, it changed the whole norm.
Yes, ma'am.
Thank you so much for your time. I
Thank
really
you,
appreciate
Kylie.
it.
I am so grateful to these kind and brave New Yorkers who were so open and forthcoming about their mental health. To my pleasant surprise, all three individuals were quite comfortable talking about their mental health. Unfortunately, this just isn't the case for most people. Why? Because of stigma. According to the American Psychiatric Association, stigma, prejudice, and discrimination against people with mental illness are a major problem, and the primary reason why people are too ashamed or embarrassed to talk about their depression or anxiety or hallucinations or other symptom related to a mental health disorder. Stigma also disproportionately affects people of color and racial and ethnic communities, where seeking professional help for a mental illness may be perceived as a sign of weakness or may be counter to cultural beliefs. We need far more education about mental illness as a health condition and not a sign of moral weakness or failure. And we need to encourage people to speak openly and seek professional help. But there's good news. Research shows that Gen Z members, aged 15 to 21, are more likely than their older peers to seek out counseling or therapy. 37% of Gen Zers report working with a mental health professional, higher than any other previous generation. So what about COVID-19 and mental health? The New Yorkers I spoke with were all affected by COVID-19. According to the World Health Organization, the pandemic triggered a 25% increase in the prevalence of depression and anxiety. In addition to COVID-19 related illness, hospitalization, and death, job, food, and housing insecurity negatively impacted mental health and well-being. Studies show that more people reported difficulties sleeping and eating, worsening chronic conditions, and increased alcohol consumption and substance use. In fact, drug overdose deaths increased significantly during the pandemic. COVID-19 disproportionately impacted communities of color. Black and Hispanic adults were more likely to report symptoms of anxiety or depression compared to their white counterparts. So how can you get involved? Normalize talking about mental health. This is how we can reduce shame and stigma. Remind everyone that evidence-based treatment exists. You can also encourage people to call 988, the new suicide prevention and crisis lifeline. Help is available. Visit the National Institute of Mental Health or Mental Health First Aid. You can also donate to and learn more from great organizations such as Mental Health America, Mental Health Innovations, and the National Alliance on Mental Illness. Well, that's all for today. Here's your Friday joke of the day. What do you get when you cross Friday the 13th's Jason with a box of Cheerios? A serial killer. Tune in this Monday, 3 p.m. Eastern, when I'll have an exclusive interview with Schitt's Creek star Annie Murphy. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.